Okay guys, we're going to discuss a few overactive and underactive muscles that could facilitate a foot flattening during an overhead squat assessment. Two common overactive muscles are the peroneals and the biceps femoris. The peroneals originate on the superior and inferior lateral aspect of the fibula. Peroneus longus runs along the lateral aspect of the leg, along the plantar aspect of the foot, and inserts on the base of the first metatarsal and medial cuneiform. Peroneus brevis runs along the lateral aspect of the leg and inserts on the base of the fifth metatarsal. Based on the anatomy, if the peroneals are overactive, the medial aspect of the foot will be pulled inferiorly by the longus, and the lateral aspect of the foot will be pulled superiorly by the brevis, causing the foot to flatten. An overactive biceps femoris can also cause foot flattening during an overhead squat. The biceps femoris is the lateral hamstring, inserting on the lateral fibular head. If this muscle is overactive, the knee will be forced into valgus. The valgus force affects further down the kinetic chain, causing tibial internal rotation, which facilitates pronation and foot flattening. A weak, inhibited, or underactive tibialis posterior and gluteus medius can also facilitate foot flattening. The tibialis posterior is in the deep posterior compartment of the lower leg, running along the posterior tibia, then medially to run along the medial longitudinal arch of the foot. Tibialis posterior supports the medial longitudinal arch. Thus, if it is underactive, the arch won't be supported and the foot will flatten. Glute med is responsible for contralateral pelvic stabilization. An underactive glute med causes hip drop. The hip drop will cause knee valgus, tibial internal rotation, and foot pronation. Overhead squat, we can see how an overactive peroneal muscle group, overactive biceps femoris, underactive tibialis posterior, and underactive gluteus medius can facilitate foot flattening during an overhead squat assessment. These four muscles, in addition to others, should be focused on in a preventative exercise program if foot flattening is found in the overhead squat assessment.